We're very, very excited to be welcoming in over 700 people who have registered for our conference from many, many countries around the world. Because this is a free conference, we're really excited to be able to have lots of people's insights, perspectives, and opinions to be shared today throughout the various sessions, the workshops, as well as through different features like our Q&A and chat feature as well. We really are excited for the day ahead, and we do hope that you take advantage of all of the different networking opportunities and learning opportunities, and also are able to bring back your learnings from today to the conference, to the rest of your community as well. So now, of course, before starting off the event today, I'll actually be starting things off with a land acknowledgement. So we actually have attendees joining in from nearly 30 countries around the world, which means that some of you might not be familiar with the practice of a land acknowledgement. So a land acknowledgement is something that we do to obviously just kind of acknowledge the land that settlers like ourselves are on here on Indigenous land, while also expressing gratitude to the traditional caretakers of the land as well. So for myself, I'm very grateful to live and learn on the traditional, ancestral, and unceded territory of the Musqueam people here on UBC's Point Grey campus, which is where I am right now. Elsewhere in Vancouver, I am also very grateful to reside on traditional Musqueam, Squamish, and Tsleil-Waututh territory too. I was born and raised in Algonquin territory in what is known as Ottawa, Ontario, and I recognize that these people have been caretakers of the land since time immemorial. Now, these are lines that we often say, and for those of you who might hear lots of land acknowledgements, this might just sound kind of regular to you as well. For me, honestly, I didn't quite understand the complexity of the term caring for this land until pretty recently. I was very fortunate to be welcomed to the land of the Coquitlam people in what is known as Coquitlam, British Columbia, on a camping trip sponsored by my university. This trip led us all along the bottom of the Fraser River, which is a really magnificent river that leads us almost throughout the entire province and provides so many really invaluable natural resources, both to humans, plants, animals, and a variety of ecosystems that kind of lie all along the river. I was really fortunate to witness the relationship between the Coquitlam people and their land firsthand, demonstrated by people like a local man who actually created bat boxes by hand to kind of resurge the local bat population, as well as being able to enjoy a potluck meal with the Coquitlam people, including fresh caught salmon that they caught that day in the Fraser River. And for those of you who might not know, the Fraser River is a really major source of salmon here in British Columbia. We were really fortunate to be able to share stories and learn a lot about their cultural practices as well. This amazing opportunity really allowed me to connect with the Coquitlam Nation as a guest and better understand what caring for the land looks like. This is definitely an important lesson that myself as a settler will continue to carry with me throughout the different lands and different opportunities that I have. As an uninvited guest on this land, it's really important for me, as well as for all of us, to be reflecting and really considering what that looks like for us. This definitely expands to the event that we have here today as well. It's really important for us to acknowledge that there is definitely a lack of care and quality care in mental health care and a variety of health settings for Indigenous people, both here in Canada and globally. So I really hope that we are able to focus on considering more about what this means, as well as focusing on traditional ways of healing in Indigenous cultures as well as we consider this event today. So I really encourage everyone, including those who might be hearing a land acknowledgement for the first time today, to really consider the relationship that you have with the land and also how we can continue to respect and learn from Indigenous knowledge as well. So now, wrapping up that land acknowledgement, I'm very happy to pass the floor on to Dr. Martha Ignaszewski, who is the education lead for the VGH CPAS service, who will explain a little bit more about that in a minute, to provide us with some opening remarks to really kick off this event. So Martha, the floor is yours.
Thank you, Marisha, and good morning and welcome to all of our participants from around the world. As Marisha said, my name is Martha Ignaszewski. I am an adult, child and adolescent, and an addiction psychiatrist, and I work at Vancouver General Hospital on the Complex Pain and Addiction Service, and I also run a service called the Substance Use Response and Facilitation Team, which is an addiction consult service at BC Children's and Women's Hospital. And those are in Vancouver, British Columbia. It gives me great pleasure to provide some opening remarks for the Translation in Action from Neuropsychiatry Research to Health Solutions Conference. This free virtual conference focuses on the translation of neuropsychiatry research to novel solutions addressing complex healthcare issues. For a provider like myself, who works primarily with youth, adults, and their families in substance use and concurrent mental health disorder treatment, conferences like this one represent a critical opportunity to apply outside of the box and creative thinking to challenges such as the opioid overdose crisis that has reached new and unfortunate milestones. As mentioned, I live and work in Vancouver, British Columbia, where many of the conference speakers today also reside. And in BC, we've reached a grim new milestone, surpassing over 10,000 individuals dying of opioid overdose since the opioid overdose crisis was declared a pandemic in 2016. This year, in 2022, deaths due to the toxic drugs in the first half of the year have already surpassed the number of deaths experienced in the same period in 2021, putting our province once again on track for a record loss of life. And currently, illicit drug toxicity deaths are the leading cause of unnatural deaths in BC, second only to cancers in terms of years of life lost, with now 6 to 7 people losing their lives daily. About 25% of the deceased are under the age of 30. And though we talk about deaths every day, thousands more are suffering. Behind these numbers are people with full lives, their family members, friends, colleagues, neighbors, and many others. And almost everyone in this province knows someone whose life has been touched by the crisis. While a number of factors have been identified as contributors to a worsening of the overdose crisis, including the increasingly toxic drug supply with fentanyl and other synthetic opioid analogs becoming the predominant illicit street opioids, other factors have also made an impact. Certainly, the COVID-19 pandemic has brought in challenges such as increased feelings of isolation, stress, anxiety, and changes in the availability and accessibility of services for people who use drugs. Nevertheless, the majority of the people that I work with had preceding mental health issues, were self-medicating trauma and chronic pain, and already had limited access to integrated mental health and substance use treatment. And to me, it's pretty clear that our current treatment approaches are not working, that novel options must be explored, especially as these unprecedented death rates that I mentioned are not paralleled across the world, with differing rates in some areas of Canada and North America, and major differences compared to many countries in Europe. And it's our responsibility to consider why this is and to explore new treatment approaches. These staggering losses lend urgency to the development of an evidence-based continuum of care that encompasses prevention, harm reduction, treatment, and recovery. Not surprisingly, one important framework to consider in today's conference is the adaptation of progress in translational research, such as psychedelic research, with success stories in novel treatments for substance use disorders, chronic pain, and psychiatric disorders. And neuropsychiatry regards the mind as an emergent property of the brain, considers that all mental disorders are brain disorders as well, but recognizes that mental phenomena cannot be simply reduced to neural phenomena. And put more simply, neuropsychiatry refers to the integration of neurology, psychiatry, and the neurosciences, and represents a field of science that has provided linkages for traditional psychiatric symptoms of disorders and provided neural correlates to brain structures and genetic abnormalities. Treatments such as pharmacotherapy and some invasive brain procedures have been established as biological therapies for mental health diagnoses, although increasingly we're integrating neuroscience into our understanding of psychotherapy, which is allowing us to better understand the biological bases of complex behavior, things like human mind, brain functions, as well as maladaptive responses, and identify scientific approaches to assess how psychotherapy can help psychopathologies to significantly transform the approaches to mental health and diseases. In my line of work, particularly in the field of concurrent disorders, the biologization of psychiatry is inevitable, and I view the brain as a plastic organ shaped by the environment and forever changing and adapting, which benefits from an integrated treatment approach with a more sophisticated understanding than the basic biomedical model brings with it. Our treatment options and bidirectional translational research must parallel these paradigm shifts. And in fact, I worry on a daily basis that efforts to treat complex illnesses such as addiction through an exclusively biomedical model will prevent any advances in changing the current trajectory of deaths. We must apply a more complex and integrated understanding to addiction and mental health diagnoses. I'll finish with mentioning that a recurrent theme during today's conference is how, for example, psychedelic-assisted therapy is being researched to allow the development of novel and increasingly successful approaches for varying mental health and substance use conditions, PTSD, suicidality, addictions, and chronic pain. But these are steeped in humanistic presentations that also highlight the importance of holistic care and ensuring that the voices of individuals with lived and living experience and recovery are identified. And I encourage each of you to listen today with a sensitive ear to these solutions that are presented that push the envelope around how we approach and manage these complex illnesses. With that, I'll pause and I'll pass on the microphone to Dr. Tony Phillips.
Thank you. I'm just lining up my presentation. Sorry, I just have to share my screen. Can you hear me?
Yes, Tony, I can share your screen or your slides if that would be easier.
Yeah, that would be easier. Thank you. Sorry about that glitch. I think I'm always amazed by the way we can pull everyone from all corners of the world to a meeting like this. So thanks for bearing with me. Can you see my slides? Thank you. Okay, well, welcome everybody. It's a great pleasure to be here. And thank you, Martha, for those poignant remarks. I think they lay out the objectives of the conference very nicely. What I want to do here primarily is introduce the team that's behind this initiative and share a few ideas with you in the process. Could you advance the slide, Lily?
You don't see the second slide?
No, I just see the starting slide right now on my screen.
We don't see it in slide mode, Lily. It's
Oh.
just on the entire PowerPoint.
Yeah. Sorry about that. I'll just try this then. Okay, I'll just advance like this. I'm not sure. Apologies.
Can we get it into the full screen mode?
I'm trying, but it's on because I'm sharing. I'm using two screens. Maybe I'll just unplug from one. There we go. Okay.
Great.
That should do it. Yes.
Okay.
Sorry about that.
Now, if we didn't have a glitch like this, we wouldn't be having an e-conference. So just to show you that this is in real time, it's virtual. I actually planned that whole delay. So thanks for bearing with me. So as we've just heard, you know, the entire globe is facing a mental health crisis of immense proportions. And when you focus in just on the opiate use disorder problem, as Martha just did, it drives home the immensity of this problem. The numbers speak for themselves. In British Columbia, as we heard, we've had so far this year, by August, 1,500 lost lives. But the issues don't just stop there. That's the mental health problem we're dealing with. Pain aspects of that are really linked in very deeply to mental health issues. And of course, the pandemic that we've all suffered through for the last 3 years has simply exacerbated all of these problems. So I suspect that many of the people that are joining us today really have an immediate concern about how do we address these problems. So one, next slide, please. One approach to this is the one we're taking at UBC by trying to encourage multidisciplinary approaches to research and innovation that relates to neuropsychiatry in particular, but really the mental health issues writ large. Now, I have to say almost as a caveat that it's not the intention of MatrixN to solve the entire problem, obviously. The key approach we're bringing is to try to bring a new lens to the research efforts, especially by bringing people from diverse disciplines together to seek solutions. So we're very much research oriented. A concept of translational research. So MatrixN, as this slide indicates, was created this year with support from the VP Research at UBC. And as the slide indicates, it's really about creating multidisciplinary collaborations between both foundational or basic scientists and especially colleagues who are clinicians and scientists together, a very special breed that are critical to this effort. And as I was just saying, we're also committed, and this will be explained in much more detail, to a concept called reverse translation, where we look for ideas from both the basic sciences and also the clinical sciences and try to integrate them into new approaches to solving issues related to mental ill health. Next slide allows me to introduce my colleagues, both cluster leads and key organizers for today's conference. In addition to myself, Dr. Tamara Vanderwall is a very active and vital member of this research team. She's one of those rare individuals I just mentioned who is a clinician scientist, and she works at BC Hospital as a child psychiatrist, and she's focusing on neuroimaging. Another key member of our team is Dr. and not just hosting, but actually creating conferences of this type for the past decade that have allowed us to bring this event to you. Michael is also a clinician scientist and a very active researcher with an emphasis on addiction research, with a multidisciplinary approach advocated by Martha. Also essential to the team is Dr. Lily Aleksandrova. She serves as cluster coordinator, and she's a postdoctoral fellow in psychiatry at UBC. And her special interest, you'll hear about it in Block C. She's interested in novel and breakthrough treatments for neuropsychiatric disorders, especially those that may arise from the renewed interest in psychedelic compounds. And last but by no means least, the real mastermind behind today's events is Marisha Boyd. She's the event coordinator, and she's been working with Michael on these events for several years and does a marvelous job. Next slide. I put this slide in at the last minute because I want to re-emphasize the point that this conference is not going to provide a solution to the enormous complex issues of mental ill health. For that, but quickly I would add, there are people and there are approaches that are trying to take an even more holistic approach to this. And one of the best examples I can think of is the approach offered by Tom Insel, the former scientific director of the Institute for the NIH Institute for Mental Health. And Tom has outlined, I think, a program for eventual solution as we could move from mental illness to mental health. We see the MatrixN approach as being one important component of the strategy advocated by INSA. We're looking for innovative solutions. It's research oriented. It's absolutely committed to excellence, and it's committed to making a difference. So, and the final slide, Lily, just again, gives you some contact information for the MatrixN cluster. You'll be, again, seeing that multiple times. But I love this picture of the UBC campus in the summer, because both the campus and this picture capture, you know, the unique opportunity we have here on the West Coast to bring creative minds together at a crossroads, where we can seek new solutions and make new commitments to dealing with the problem of very exciting day. I'm delighted to be part of it, and I look forward to learning a great deal. I'll have some more words to say throughout the day and also at the end of the event. So thank you very much for your attention. I think we're moving on now, Lily, to Dr. Trevor Robbins, and I know you're going to introduce him.
Yes.
So thanks very much.
Thanks, Tony. Good morning, everyone. Welcome again. My name is Lily, and I'm, as Tony mentioned, the postdoc as well as the coordinator for the MatrixN cluster. So before I introduce our first distinguished keynote speaker, Dr. Trevor Robbins, I wanted to encourage you to learn more about the cluster by going to our website or contacting us with any questions, thoughts, or ideas after the event. And I would also like to point your attention to two of our engagement or networking opportunities today at the conference. First off, if you have not already, please answer the poll questions that were prompted when you entered the session, or you can find them by navigating to the poll tab on the right-hand side on the Whova platform. We would like to hear from you on some of these questions related to what translational research is and how hard it might be to do. These questions will be open all day, and with input from the audience, we'll revisit them in the closing session of the conference. And another great way to learn about the cluster, meet me and other cluster members, is to join our lunchtime networking or meet and greet session. And this you can find on the Whova event agenda.